my name is Maggie Burton, and this is my neurovascular skills video for BSM 366. I have all my necessary equipment, my watch, stethoscope, badge, white shoes, and today we're going to be going to see our patient to do a neuro system check. So we're going to knock on the patient's door, provide privacy, wash hands. Hi, my name is Maggie, and I'm going to be your nurse today. Can you please verify your name and date of birth for me?
Daniela Alston, 1/18/2000.
Okay, so today we are going to go ahead and we're going to be doing a check for your neurovascular system. I'm just going to do a couple checks throughout your body and go ahead and check out your neurovascular system. And so first I'm going to start, I have some objects here for pain, dull, or touch. So if you could close your eyes, and I'm going to touch your arm with a couple different items, and if you could tell me if it is pain, dull, or touch. Okay?
Dull. Touch. Touch.
Okay, great. So no issues there. The sensation to pain and touch is there. So next we're going to go ahead, and if you could close your eyes, and I'm going to put a familiar object in your hand, and if you could touch it and feel it around in your hand and tell me what it is.
A clothespin.
Yes, thank you. Okay, so now we're going to go ahead and I'm going to check your fingers and your toes. So if you could close your eyes and put your hands out, and I'm going to either move your fingers up or down, and if you can tell me if they're moving up or down, and then I'll do the same with your toes.
Up. Down. Up. Down. Up. Down.
Okay, great. So now I'm going to go ahead and we're going to go from 2 points to 1 point. So if you could close your eyes, and on your arm, I'm going to go ahead and I'm going to place an object where it hits 2 points, and then please tell me when I go from 2 points to 1 point.
Previously one.
Okay, great. So in a normal assessment, we would go ahead and we would measure the distance between there, but for today, we're not going to. So now I'm going to go ahead and I'm going to write a number in your hand facing the camera. So if you could close your eyes, and as I trace the number, tell me which number you feel.
3.
Okay, great. Now I'm going to go ahead and I'm going to, you can keep your eyes closed, and I'm going to press the object down, and then if you could go ahead and point to where I touched you, okay? Okay, great. So the 3 different points on her body for the parts, she passed that test. So now I'm going to go ahead and I'm going to test your deep tendon reflexes in your brachial and in your patellar. So normally for this, we would use a reflex hammer, but I have my stethoscope. So I'm going to go ahead and I'm going to place my arm or my thumb here, and I'm going to hit it. Perfect. Okay, so the brachial reflex works great. I'm going to go ahead and move this down just a little bit to show the patellar. Okay, great. So no issues with your reflex there. Each deep tendon reflex elicits a response. So now I'm going to go ahead and I'm going to test your plantar reflex and your ankle clonus. So from here, I'm going to go up, okay, so the plantar reflex is correct, and then now I'm going to go ahead and test for ankle clonus. So because the foot goes back down, she has the proper ankle. Now we're going to go ahead and we're going to check the cerebellar function and the proprioception. So if I could have you run your ankle down the other side of your leg on each side. Okay, great. And next we are going to just jog in place. Okay, great. So lastly we're going to evaluate your coordination and your fine motor skills. So if you could go ahead, I'm going to change the camera. So you're just going to take your nose, your finger to your nose. Perfect. Okay. Perfect. And we already did the running in place to evaluate the fine motor skills. Now we're going to go ahead and we're going to check your Romberg status. So we're going to test your balance. So if you could stand up and close your eyes. And I'm going to keep my hand back here for support. And for 50 seconds, you're going to stand here, and we're just going to make sure that your balance is okay. Okay, so we're going to pretend that 50 seconds has passed and the patient has completed the Romberg test. Lastly, if you could go ahead, I'm going to monitor your gait. If you could walk towards the monitor and walk back, and I'm just going to go ahead and take a look at your gait. Okay, great. You can have a seat. So the patient has great posture, great rhythm, no use of a walking aid, and no deviation of path. Great stride, was completed in less than 12 seconds, and feet cleared the floor and cleared each other. So overall, we've completed the neurosystem check. I have no concerns. And do you have any questions for me? Nope. Okay, great. So I'm going to wash hand. I'm going to practice hand hygiene, and I'm going to leave the room to document.